Oranusi.
And my name is Bernadine Agan, and we are presenting our concept map. We have a 27-year-old white female who presented to the office with chief complaint of feeling tired all the time, having dizzy spells, and feeling as if her heart is pounding at times. She presents with a 3-month history of feeling tired all the time, having dizzy spells on occasion. She complains of her heart pounding, onset 2 weeks ago. She describes more difficulty completing daily tasks, quotes, because I feel exhausted all the time, end quotes. She states that she takes 2 or 3 naps throughout the day, but states that this does not help her. She describes the dizziness as head spinning and lasting just a few seconds. She states it can come on at any time of the day. Nothing seems to make it better or worse. She has occasional nausea with these spells, no vomiting. She denies passing out. She states the pounding of the heart only happens once or twice every few days and is very brief, maybe lasting a second or two. She denies increased stress, anxiety, or depression. She describes heavy menstrual periods in which she changes her maxi pads 5 to 6 times a day, but she does state that this is not unusual for her. She states it usually lasts 8 days and is regular in timing. Last menses 1 week ago. She also states she has been eating a lot of ice lately. She has a past medical history of migraines, for which she takes Tylenol extra strength, 650 milligrams every 6 hours. She also takes a multivitamin, 1 tab PO daily, and she's been taking that for 5 years. She takes ibuprofen, 400 to 800 milligrams PO Q6 hours, whenever she has cramping when she's on her period. And she also takes zinc, 30 milligrams every day. She has an allergy to penicillin, and she states she gets hives with these. She is current on her flu shot. She's unsure if her MMR and DTaP are up to date. Her family history is non-contributory. Her social history, she denies alcohol use. She smokes a half a pack of cigarettes a day. She denies illicit drug use, and she works part-time as a waitress and has no children. For the review of systems, she denies recent weight gain. She denies fever. However, she reports fatigue. She does report dizziness as well. She reports no problems with her vision, no problems with hearing, and no drainage in her ears. She denies any cardiac history, and she also denies fainting. She denies difficulty breathing. She does report some nausea, but she denies vomiting. She denies foul smelling, black or tarry stools. She denies diarrhea or GI upset. She also denies abdominal pain. She denies bleeding between periods. She does use condoms for birth control, and she is sexually active. She denies numbness, tingling, or weakness. However, she reports dizziness, as we've stated before. She denies past transfusions, and she denies cold intolerance.
Objectives. General appearance includes patient is well groomed, age. She is alert and oriented to person and in no acute distress. However, she does appear tired. Vital signs. Temperature is 98.6. Blood pressure 118/83. Heart rate 105. Respirations 20. Her weight is 185 pounds. Height, she's 5 feet, 5'6". Pain is 0 out of 10. Physical examinations. Her skin is warm, dry, and intact. However, mild pallor noted, no cyanosis. Normocephalic with no trauma. Eyes, her sclera is white, the conjunctiva is pink. Pupils are equal, round, reactive to light and accommodation. No hemorrhages or exudate noted. Her tympanic membrane is intact bilaterally, no structural damage to the ears. Mouth is moist, pink, and intact. No lesions or ulcerations noted. Neck is supple and trachea in the midline. Her thyroid is palpable with no enlargement. It is soft, smooth, symmetrical and non-tender. Her heart has regular rate and rhythm, no abnormal heart sounds auscultated. Lungs are clear to auscultation bilateral. Neurologically, she has clear speech without cognitive impairment. However, her Rumback test elicits dizziness. Her abdomen is soft, non-tender, palpated. For the diagnostic tests and labs, her CBC came back with a hemoglobin of 10.2 and hematocrit of 32%. We checked the glucose finger stick and it was 96. Her urine pregnancy test is negative. EKG shows normal sinus rhythm. The differentials we have for the patient is pregnancy, hypothyroidism, and arrhythmias, and also iron deficiency anemia. For pregnancy, we chose this because of fatigue and also because patient is of childbearing age. For the hypothyroidism, she's experiencing fatigue and palpitations, and we have to rule that out. Arrhythmias, she is having fatigue, dizziness, palpitations. And for the iron deficiency anemia, she's having pica, fatigue, dizziness, palpitations, heavy menstrual period, and also she's taking the zinc medicine, which can inhibit the absorption of iron. For this patient is iron deficiency anemia. The ICD code 10 of D0.9. The plan here includes ferrous sulfate 325 milligrams PO daily in the morning. We also want to send out T4 and TSH labs. We will encourage patients to eat iron-rich foods and food high in vitamin C. Education about ferrous sulfate includes that the medicine will darken her stools. It may cause nausea, constipation, and some stomach upset. We want her to take this with meals. Do not take it 2 hours of other medications. Do not take with dairy products, tea, coffee, whole grain cereals, breads, 1 hour before or 2 hours after taking iron supplement. We also encourage the patient to stop taking the zinc because, like we said, it inhibits the absorption of iron. We also have to follow up in 3 weeks for a repeat CBC. And this concludes our presentation. Thank you.